My name is Rachel. I'm doing a report on a 16-year-old Native American male that I did a head-to-toe assessment on. He came in, he was alert and oriented ×3. His speech was clear. English was his first and native language, and he only spoke English. He had good nutritional status. He had access to 3 meals a day. Good nutritional status. His BMI was 23.7, which was based on his height and weight, and it falls into the normal range of weight category. He came in and he had a good steady gait. He came in and sat down. His posture was upright, straight. He sat upright and straight. He had a good posture. He had no obvious deformities. He denies deformities. He did not use any assisted devices. Not use any devices. His mood was happy. He characterizes himself as a happy person normally. He had good hygiene. He was nice and clean. There was no odors or anything noted like that. I then moved on to his upper extremities. His skin was tan in color, appropriate to his race. There was no scars. His hair distribution was even. It was warm, clean, dry, intact. I moved on to his hands. I checked his turgor. It was good elastic, non-tinting. His nail beds were clean. His capillary refills were less than 2 seconds. Bilaterally, I checked him on both hands. Clean nail beds. Capillary refills. His hand grip was strong, equally strong and equal bilaterally. I checked his radial and brachial pulses. They were +2 bilaterally. What else did I do? He had full range of motion in his upper extremities. He had good strength in his upper extremities. I then moved on to his head. It was normal cephalic, no bruising, no lesions, no bumps. There was no signs of any infestations or lice or anything. There was no dandruff. His scalp was really clean. His hair was clean. It was nice and thick and full throughout his whole scalp. There was no tenderness when I palpated. I then moved on to his face. It was symmetrical. I assessed his cranial nerves 1 through 12, and they were all intact. I palpated his temporal arteries. It was equal with no thrills. I palpated his maxillary and frontal sinuses. They were non-tender. I moved on to his neck. It was symmetric. There was no tenderness with palpation, no pulsations noted, no masses. His trachea was midline. I palpated his lymph nodes. They were non-tender, no masses. No, they weren't enlarged. Cranial nerve 11 was intact. He had full range of motion in his neck. I palpated his thyroid. It was not enlarged, non-tender. He had no jugular vein distension. What else did I do? No jugular vein distension. I then moved on to his eyes, yes. The outer structures were like his eyes are symmetrical to his face. His outer structures were, they didn't have any irritation on them. There was no drainage. No irritation, no drainage. No irritation, no drainage. His eyelashes were full. There was no irritation on his eyelids. I think that's all with the outer structures. His conjunctiva was pink, his sclera was white, his iris was brown. I assessed his cornea from the side. It was non-concave, it's clear, round, non-concave. I already assessed his cranial nerves. His pupils were equal, rounded, and reactive to light and accommodation. I moved on to his ears. I palpated them. They were non-tender. There was no drainage, no irritation. There was no masses. To his nose. His nose was in the middle of his face. It was midline. His nares were clear. His mucosa was pink. His septum was midline. Septum was midline. I then moved on to his lips. They were full, moist. There was no cracking, no dryness, no irritation around his lips or on his lips at all. His buccal mucosa, gums, teeth, hard and soft palate, tonsils, tongue were moist, no exudate. I then moved on to his lungs. AP to T diameter. What else did I assess? Respiratory rate was 16 breaths per minute. He did not have any use of accessory muscles. His breaths were even, unlabored. His lung sounds were clear to all lobes, anteriorly and posteriorly. There was no adventitious lung sounds. Resonance was predominant throughout. I assessed both anteriorly and posteriorly. No tenderness with palpation. No CVA tenderness. His heart sounds, I auscultated them sitting and standing. No gallops, no murmurs, no rubs. S1 and S2 noted. I assessed his heart rate. His apical heart rate was 70 with regular rhythm. The PMI was at the 5th intercostal space in the left midclavicular line. What else did I do? 5th intercostal space, midclavicular line. I already did his heart rate. It was hard. S1 and S2 noted. Oh, I can't think. His abdomen. I did his abdomen. Okay, I assessed his abdomen from the side. It was flat. Good contour. His skin was tan. The color was appropriate to his race. There was no scars, no striae, no pulsations. No scars, no striae, no pulsations. His abdomen was non-tender with palpation. Tympany predominates throughout his abdomen. Bowel sounds present in all 4 quadrants. I then moved on to his umbilicus was midline. His abdomen was symmetrical. I then moved on to his lower extremities. His lower extremities were symmetrical. His skin was tan. It was appropriate to his race. His skin was warm, dry, clean, intact. There was no scars. There was no varicose veins, no edema. Varicose veins, no edema. Excuse me. I palpated his pulses. They're present bilaterally. Present and strong bilaterally. That was his femoral, his popliteal, his posterior tibial, and his dorsalis pedis. He had full range of motion in his lower extremities. He did have full range of motion in his lower extremities. And good strength in his lower extremities as well. I tested that too. Those extremities. His heel to shin test was negative bilaterally. His patellar reflex was positive at 2+. He was negative for scoliosis. His shoulders, scapula, elbow gap, iliac crest, and gluteal folds were symmetrical. So that was the face, lungs, heart. He had full range of motion in his extremities. I believe I said that. All extremities, so it's upper and lower. I did his abdomen. I believe that concludes my report on this head to toe physical assessment. Thank you.